The Adulting with ADHD podcast is not a substitute for medical advice. Please see a medical professional if you think you have ADHD or have ADHD and need additional assistance. For podcast archives, please visit patreon.com/adultingwithadhd. This is the Adulting with ADHD podcast, self-empowerment for people with ADHD. Today, I'm excited to have with me Dr. Luke Smith, founder of Futuro. It's a community-based nonprofit organization that seeks to transform Latinos serving mental health care in North Carolina and beyond. Welcome to the show, Doctor.
Thank you very much. It's great to be with you.
To start, tell us a little bit about yourself and how you came to specialize in culturally responsive care for Latinos.
Well, I am working in a Latino serving organization, and I'm not Latino. I'm from Arkansas. Sometimes my joke is that I moved to the north when I moved to North Carolina. So I migrated, which is silly and funny, but it was a little bit of a change for me. I went to North Carolina to do my training in psychiatry residency and then a fellowship in child and adolescent psychiatry. And during that time, I was around the Latino culture and fell in love with culture and just the differences that culture makes on treating people with mental illness. And I found that to be as fascinating as the work that I was doing learning about psychiatry.
Right. Yeah. So why is this model of care so important? It seems like the emphasis here is culturally responsive care. Can you talk a little about that?
Yes, I can. The phrase that we've used sometimes is culture cures, and that we understand as sociologists and social workers and psychiatrists or mental health professionals have traditionally seen that people who feel in community, who feel understood by people around them, their culture, that if it's a positive culture, that it can be healing and therapeutic. For the Latino community where I work at El Futuro and the work that we've been doing over 20 years, we've valued that and really enhanced that as part of our actual practice. How do we bring people together around culture, deepen their roots and connections in that way? And that's what we've found is protective and helpful for them in their healing or just in their well-being.
Can you give us some examples of what that looks like?
Yeah, just a week ago during Hispanic Heritage Month, we had a huge cultural community fiesta called a kermés, which is in Latin America very traditional, and it brings people out to make food and share their crafts and play games and raise money for an event of some sort. That would be one example. For us, what we see is that when people participate in that it reduces their feelings of stress, reduces depression and anxiety, increases togetherness and reduces loneliness. It makes people feel proud. And right now, especially in a time where immigrant communities are feeling under attack and threat and feel they're not being accepted or welcomed, that makes them feel a sense of belonging. And that's really important. So that's a way that we can, I have a hope someday, I haven't done this, I've done a draft of a t-shirt that says Prozac, it's all P words, Prozac and psychotherapy and parties and play. And this would be a pachanga or a big party of some sort, or push-ups, like physical exercise. There's a lot of P words, it turns out. Painting, planting, there's a lot of wonderful P words that you can put in there and kind of say, it's not all about a medication or a psychotherapy necessarily, but it's a lot of other things like that party.
I love that. Yeah. What are some of the challenges you've encountered with your ADHD patients specifically? And where does culture fit into that?
Well, the culture that we're in very much segments and silos people. And in Western medicine, the medicine that I learned around ADHD in particular was, first of all, to label it as a disorder. And I think a lot of people are relabeling it as, actually, this is not bad. There's some really great parts about being attentive to everything all at once, but sometimes you need to focus and you need to actually lock in. But the way that we have traditionally done that is to do a quick rating scale and give them medicine. And I found that a lot of families were coming to me and they were already wary of medicine. And they were first leading with, is there anything but medicine that we can do? And I didn't find myself real prepared to address that question. And so as we thought about that, we actually brought the families in and we said, all right, let us hear what you're thinking. First of all, how do you understand what is ADHD in your own language, not in our DSM-4 language? And then what are the things that have helped you so far? And that was very eye-opening for somebody who had trained as long as I'd trained, thought I was all that. All of a sudden I was listening and really learning a lot from these parents.
If adulting with ADHD feels overwhelming, you are not alone. ADHD Online provides a diagnostic evaluation that offers personalized insights to help you navigate ADHD and beyond. Aside from ADHD, it's looking at anxiety, depression, binge eating disorder. You can take those results and you can go to your own practitioner, or they have practitioners that can help you. Listeners of the Adulting with ADHD podcast save $40 off and receive a $149 diagnostic evaluation by visiting adhdonline.com/adultingwithadhd. Is hemp product overwhelm leaving you dazed and confused? Find dispensary-grade hemp products at the Kush Cave. Discover targeted comfort with topical roll-ons and salves. Unwind after work or drift off to restful sleep with expertly formulated gummies, drinks, and oil tinctures. There's free shipping on orders $99 and up. You get a 20% off promo for joining the email list. Visit kushcave.net. Welcome to the cave.
Yeah, absolutely. And how does the care that you're providing differ at all because it is culturally responsive, or can you talk a little bit about that?
Yeah, there's a lot of examples that I could give around that. I
do.
think maybe I'll start with just principles of how we're understanding what is the best kind of treatment. And we, first of all, want to make sure that if it is ADHD, it really is ADHD. In a culture or in a language change, that there are some other things that can be very distracting and disruptive for kids and families. There's a lot of stigma and a lot of biases in there. And so the first is just understanding it and describing it and using language that people can understand. And that sometimes happens in individual communication with a provider like me, or it happens maybe with a cultural ally, somebody who looks like that person and can talk with them after an appointment. Or we've a series of videos where we do conversations to normalize it. And so we have a parent who is from country that maybe this other parent is from, and we have a short little 8-minute conversation and just talk about what does it mean to be impulsive? And all of a sudden they go, oh, I'm not the only one with a kid like this. And this really is legitimate. This is something. It's not just what my mother-in-law has told me, which is like, I'm a bad parent. And so it really starts with that first initial, what is it? What's going on with my kid? And then how do we socialize that and communicate it in a way that the parent doesn't feel further put upon or stressed because they've done a bad job? So that's the principle. And that's an example. The other principles that we use besides psychoeducation or just education and acculturation of what this is actually the treatment or the support that we provide. And so we see coaching is essential for the parent. Oftentimes the parent also has ADHD or one of the parents does. So we need to actually help that parent with their own distress and help them, but also how they can behaviorally shape what they're doing at home to better support their child. If the child is old enough that that child can also do their own coaching. And I say that because we've really found that the smaller children have a little bit more difficult time engaging in formal coaching. It's more going to be what the parents do to shape them on a daily basis. School supports is another really big thing that we invest in. How can we get environments better for these children? And, a lot of those environments don't understand just as much as a family member doesn't understand and actually criticizes the mom. Same thing happens at school. The teachers and staff look at that mom and say, well, it's just because you didn't speak English at home, or because you're not reading to them enough, or because you're not disciplining them enough. They're not acknowledging, hey, this is a kid with a different learning style. And it's not a kid who is less capable, but actually just needs to be helped differently. And then the other thing that we do is let's go out and let's go on a hike. We take our kids and our families, and we've done this primarily with the kids and the fathers who don't oftentimes come to the appointments. And so we go on hikes, we go camping, we do things that are very physical. And in those, we have opportunities to do more education and more socialization with other families so that dad perhaps looks at another dad and goes, oh, your kid's got that too. I thought it was just my kid being misbehaved. And then they start to have conversation. I'll give another example of something that we've done. So behavior parent training is a gold standard. American Academy of Pediatrics. This is the way we help parents know how to help their children. And we looked at that and we saw that, well, that's been around for 20 years and is well studied and well validated that when done in another language, it's kind of like a Google Translate moment, but it's not really adapting it in a way that makes a lot of sense for those parents. So pulled it apart and put it back together, did it in a research collaboration with Duke University's ADHD program. And then we validated it on the backside to say, hey, does this work? And we saw parents really engaged. We did things like realizing, and this was all online. It's an online class because we can reach more people. It's free. Parents from all over came into these classes, and we would send them a workbook because we realized that a lot of them were watching on the little screen on their telephone, and that was not big enough to see a PowerPoint. And so we would send them a workbook. They would go through, do homework exercises. We taught the things that I've mentioned, which are around psychoeducation, education about what it is, empowerment for school, other enrichment resources they can do, their own emotional regulation. As we know with ADHD, that is true for children and adults who have ADHD, that emotional regulation is challenging. And it's especially challenging when you're dealing with that kid who just sets you off. And then we did ABC, antecedents, behaviors, consequences training, which is a very tried and true parenting methodology. We taught these parents how to do that. We do role plays. It's beautiful. It's like 8 sessions. We facilitate this. We do this on an ongoing rolling basis. And we have people now, because it's online, from other states, other countries who join in. It's all in Spanish. That was really helpful in a lot of ways, because as we evaluated it, we saw people feel better about their parenting skills and know how to handle their kids, feel more empowered to go into the schools. One of the big things that I always watch that is just amazing and consistently happens is the parents do this moment where they step back and they see all these other parents in the class and they say, oh my goodness, I'm not the only one with a kid like this. It's not my fault. And listen to other ideas, and all of a sudden they get more confidence. And that right there, I think, is so important in everybody's journey along this road of their own struggles with their own ADHD or with their child's ADHD, is just being connected. I love your podcast because that's what you're doing. You're connecting people with other people. And I think that that's an essential component, that I don't need to go to medical school and psychiatry program and prescribe a medication or something to get that kind of outcome. That outcome is golden. And I'm so glad to see people rushing into that space to do that kind of linkaging and connecting.
Thank you for saying that. Are you guys still giving that class? Is it an ongoing thing? Where can people learn more about that?
It is. It's all in Spanish. We have hopes to make it into English at some point. It's called El Faro, which is lighthouse in Spanish. That's how that's said. And it's kind of a lighthouse class for these parents. And so it's online. It's on our website at El Futuro. We hope to do it in English at some point. We also are in a season right now where we're surveying and we're listening to adolescents and their parents, because that class was really developed for pre-adolescent children, parents. It's just for the parents. It's not for the children. It's for the parents. But we'd like to do something for adolescents, because we haven't got that class for adolescents. We may do individual work with adolescents, but we really need to do a better job for the adolescents. And then after that, we're going to squarely look at adults. Even though we do that kind of work, we just want to keep building out our toolkit to help more and more people.
I love it. And again, where can listeners keep up with you and your work? What else do you guys have resource-wise?
Yeah, well, we have social media that I'm not always I'm over 50 now, and so I'm not always the best on that, but we have Facebook and Instagram, and we have our website. We have a whole web page dedicated to our program where all of our videos are on there, registration for those classes, other resources, and we're very open for collaboration. We're finding that one of the bigger structural issues right now is that the healthcare agencies, Medicaid or CMS, people in those positions have not valued yet either the impact of ADHD of people's lives and valued it as a diagnosis that actually needs to get help and support, or have actually acknowledged that there's a treatment outside of a medication. To get reimbursement for coaching, for running one of those classes, for supporting the school intervention, that's not reimbursed. That's not something that healthcare payers are yet willing to acknowledge as needed, even though it's a best practice and it is exactly what the evidence is saying we need to do and has been saying for a long time. It's not valued. And so we need to push forward, keep doing those practices that are, like you said, whole person care. And then we need to really advocate for those bigger healthcare entities to actually put their money where their mouth is and say, this is what we need to do to help these kids, these adolescents, these adults to flourish and have success. Because short of that, just paying for a medication is not going to do it. We all know that. And it can be very helpful, definitely. And it can also be harmful, and it can also not be exactly what the person needs. But you have to consider each person individually.
If you could even access it.
If you can even access it. I just this morning was texting back and forth with a mom who I had prescribed medicine for last week and trying to explain what is good RX because she doesn't have insurance and she needs to find it. And then I need to be a sensitive practitioner to make sure that I prescribe one that is supported by good RX and a pharmacy that will acknowledge that as well. So there's a lot of little nuances in there, and it's not as black and white or as simple as put them on a long acting stimulant that's too expensive that insurance won't pay for and that is going to cause a host of side effects potentially that you overdosed and didn't give it an appropriate level. There's a lot of nuance that needs to be thought about.
Absolutely. I can attest to that firsthand. It's a very tricky constellation of stuff.
Yeah.
For sure.
Yeah. And I think one other thing is that we really think I'm a big fan, and our team is a big fan of lifestyle medicine, what's been called lifestyle medicine now. And all of those pillars, every family I meet with, I go through a little quiz and talk about how do we increase the dopamine in our brain? What are the things that we do that? We do a quiz and I have the kids and the families respond on what is it like to eat protein-based nutrition and plant-based nutrition and physical activity and being in nature and how that boosts your attentional abilities and getting good sleep and staying off the technology. These are just foundational elements that every practitioner now needs to really be on top of and say, I know this stuff, I believe it, and I'm going to preach it out because this, and then do it in a motivational interviewing kind of way where we are not preaching it out. That was the wrong word, but really empowering out.
Yeah, I was in an appointment recently and the doctor pulled out an image and was, this is your brain on a screen after 2 hours. Oh, and so effective. I love that kind of stuff.
Oh man, I want that image. That sounds really powerful.
Yeah. Well, Dr. Smith, thank you for being on the show.
Yeah, thank you. Been a pleasure.